countries. Nearly 1,800 people are affected. 962 died.
On Face the Nation Sunday, a doctor with the World Health Organization explained why containment is so difficult.
We're dealing with areas in which practices like good infection prevention and control practices are not the norm.
Modern medicine has come so far in the last century or so. Some would even say in the last 50 years, great and historic strides have been made to eradicate and control certain diseases. But there is no instant cure for anything. There is no magic pill. And that realization is once again smack dab in front of us when faced with something the likes of Ebola. We hear the words possible cure and might even believe it's close. However, there simply cannot be a rush to judgment or potential cure if we indeed seek to keep this deadly virus from spreading around the globe. Let's welcome to MidPoint, Chairman of the Columbia University Biosafety Committee, Professor of the Department of Epidemiology at Columbia University, Stephen Morse joins us. Doctor, thank you so much for being here today.
Thank you. Glad to be with you.
The one thing that catches me immediately is this report from the World Health Organization saying it is ethical to offer unproven drugs or vaccines to people infected or at risk in West Africa's Ebola outbreak. That has to be a stunning admission from WHO, and some people would almost see it as a move of desperation.
Well, there's a lot of discussion about the ethics of this particular issue, and one of the problems that still exists is that there probably will not be enough to go around for all the patients, and deciding which patients should be getting it will be a difficult decision. There was criticism when the two Americans received this treatment, but on the other hand, people say if they had given it to the local patients first, there would be a feeling that perhaps we were trying out something untested on the African population. So I think it's good that it's been tried in a couple of cases, but clearly it's going to be hard to decide who should get it now.
Now, let's talk about the Americans here. Is it proper to say that the Americans perhaps received the drugs because their general health would have been better and that would have been a better testing ground in order to go after these various drugs?
Well, I think the main reason was probably that there was very little of this, and they were the most likely candidates because, yes, one was better, the other one was not doing so well, but I think getting them out of the battlefield, if you will, would obviously be better for the other healthcare workers. And if you're going to experiment with a new therapy, I think they had the best chance. I think they just happened to be there.
I know this may go against a lot of medical ethics here, but when you have something that is as dangerous as Ebola, that is spreading so fast, and that quite frankly, even doctors themselves are throwing their arms up going, what do we do next? Is it not then not only ethical but necessary to take these experimental drugs and, as dangerous as it might be, use them on humans and try to do something instead of just simply waiting for trials which never seem to end and are always years away?
No, absolutely, and that is, in fact, the ethical position most people take. Similar to cancer chemotherapy, if you have a cancer that's fatal, for which there is a very poor outcome, and there's some experimental drug, it's ethical to try that because there's no other way to be sure of saving or to have a hope of saving someone's life. So I think that makes sense. But some data will have to be collected in order to understand how these new drugs can be used effectively, how well they work, to make sure they're safe, and obviously to understand the right dosage and the right way to administer them if they are useful, as they seem to be.
Doctor, I'm going to take a step here maybe into science fiction or into some areas that people always like to discuss in cases like this. And this has got to be something that you have heard before. When we see drugs such as these being introduced suddenly, and again, we're talking about the general public who will all of a sudden hear about them, for a disease that is as deadly as Ebola, people are always going to be sitting back and wondering, I wonder how many other drugs that they have sitting there. I wonder how many other cures they have for serious diseases, yet the drug companies simply don't want to release them. They're hiding something from us on a regular basis just in order to make money. I know you've heard that before. How do we then answer the public who is saying that today?
Well, I think the drug companies would gain a lot more by making these products available because then they could get revenue from it. So in most cases, it's not a matter of keeping something back, but making sure that they know it's safe and effective. But in this case, there are some general lessons that might well apply to other serious infections. So the antibody preparation they're using, ZMapp, could be tried in other types of serious infections. There are a couple of drugs in the pipeline now that are antivirals of pretty broad applicability. So those could probably be used immediately once we understand how to administer them and make sure they're safe and effective, used immediately on many other viral infections.
Here's one of those instances, and I want to point this out to you. The graphic will be up here for our audience to see. I'm going to read it for you. This is Tecmira Pharmaceuticals. Their stock went up 22% on Friday morning after they announced they had verbal approval from the U.S. Food and Drug Administration that would fast-track their new drug to treat the Ebola virus. I think the U.S. Food and Drug Administration that would fast-track their new drug to treat the Ebola virus. I think this is the sort of thing that people are worried about. Should we be concerned? And again, I understand you and I hear you that they would make a lot of money if they basically produce these drugs. But it's also waiting for the right time. You've got to wait for the right time in marketing, in PR, and the right time that it's needed. I hate to be callous, but that's just the way it is sometimes. There are people out there wondering, is the FDA keeping these things down? And are the pharmaceutical companies just holding off? Could they just be hiding to make sure that they make more money?
Well, it would be nice to think that there's a miracle cure somewhere around the corner under wraps. I'm not aware of any, but yes, this company has been working, Tecmira has been working on a drug against Ebola, and specifically because they were asked to by the Defense Department that was worried about the fact that we didn't have anything to use to treat it. And it has obviously been the right timing for the company. I don't think they could have gotten much out earlier, but the reality is with a rare disease like Ebola and many others, there are very few opportunities to test it. And this really is going to be very good for the company and good for all of us because it'll be tested very quickly and in a real world situation and might even save lives.
How frustrating is it for you as a doctor?
More drugs in the pipeline. Every so often, some new anti-infective or antiviral comes out, but they come out very slowly because we've largely exhausted, or in the case of antivirals, haven't really found the best targets, the best ways to go. So, that needs innovation. I understand the FDA can be a protracted process, but I think they're really in a difficult position. They have to assure that drugs that are being used are safe and effective, at least safe, and at the same time, obviously, they want to make these things available for people. So I think it's really very hard to find that right balance. And I think right now, using this on an emergency use basis, the FDA does have a procedure for that, and they are probably going to be using it on that basis. And that allows a compromise that will make it available when it's needed and able to test the drug so we know if it really is working.
ZMapp is the drug we're talking about here. It's from MEP Biopharmaceutical Inc. I believe it's a San Diego-based company. From your own...
Promising, but, hopefully we will find out soon.
With about a minute or so that I have left here, as a physician, how concerned are you that the Americans are now on American soil bringing Ebola here?
I don't think there's any risk. They're being kept under very tight isolation conditions. The healthcare workers and other people who are coming in contact with them are using very rigorous infection control, basically the same precautions that should be used in the outbreak in Africa, but of course it's easier to do it here. They're getting, obviously, regular monitoring, and I don't think there's really any likelihood of other people catching it beyond those who are in immediate contact.